Hi, I'm Rhinoplasty, a double board certified facial plastic surgeon here in Houston, Texas. A common question I get in my DMs on my social media channels is how to prepare for my first rhinoplasty surgery. I thought it'd be a good video, since I get this question with some degree of frequency, to put out a video out here to maybe help other people on preparing for surgery. So preparing for surgery, for rhinoplasty surgery specifically, is like preparing for any other type of surgery. So a lot of the things that I'm going to say here kind of hold true for different types of surgery as well. Now, a major disclaimer that we need to get out of the way before we go ahead and start down this road is that every surgeon has a very detailed protocol on what they want for their patients. Part of this is science, and part of this is just the way things are in terms of that surgeon has done something for a while and it's worked in their hands. So please, if you have questions or what I'm saying here is at odds with what your surgeon has told you, please give your surgeon a call. Please ask your surgeon and follow what your surgeon says. So a lot of the things that I'm going to present here should be relatively universal. However, a lot of this is also based on my experience, and I've done a lot of rhinoplasty surgery. Okay, so starting to prepare for a rhinoplasty really starts at about the 3-week point before surgery. We normally like to do our preoperative assessments on patients about 3 weeks before surgery, and there's a reason for that. The first thing is that it allows us to reconfirm a lot of the information that we found on consultation. So when we do a consultation, we go ahead, we ask patients about their medical history, so on and so forth. Now, when we get to the preoperative assessment, that whole process is rechecked, as well as there's things done like a physical examination and vital signs and the such. So if something comes up, for example, a patient is found to be hypertensive, it gives us time to send that patient to their primary care provider in order to get a further workup done. It's not something that we have to suddenly rush through or cancel surgery or call a PCP and get the patient in emergently. So there's a lot more calmness in the whole process. So that's one of the primary reasons we really like to start this process about 3.5 weeks prior to surgery. Also, as you're going to see through this conversation here, there's a lot of things that I start doing with patients at about 2 weeks before surgery. So therefore, by seeing them 3 weeks before surgery, it gives them kind of a little bit of time to get prepared as I tell them to start doing things. Okay. So once that process is done with the preoperative assessment, the next major thing is the 2-week point before surgery. This is the point where I tell patients, hey, listen, number one, stop Aleve, aspirin, ibuprofen, all that category of medications. Why is this? So Aleve, aspirin, ibuprofen, Advil, all these medications fall into a category of medications called NSAIDs. NSAIDs are anti-inflammatory medications, and they all work by a certain common pathway. However, one of the side effects of these medications is the fact that they inhibit platelets from clumping together. So when we have a cut, there's bleeding, whatever that process is, the way that the body stops bleeding is by the coagulation cascade. And these NSAIDs affect that coagulation cascade at one of the most primary steps at the level of the platelets. If that happens, first of all, you're going to have a couple of downstream effects. The first downstream effect is during surgery, there's going to be more bleeding, oozing. Now, that's a little bit more difficult to do surgery under those conditions. Can be done, but still a little bit more difficult and a little bit more time consuming. For the patient, what that means is that after surgery, if there's still some persistent bleeding or oozing, there's going to be increased bruising, increased swelling, which then translates to an increased overall recovery time. So what I tell patients is as follows. First of all, stop those medications. If you have a headache or you have a backache, neck ache, whatever, those general aches that people sometimes get, don't go rush for the aspirin or the Advil. Use Tylenol instead. So Tylenol is a medicine that reduces pain however, does not have the same side effect because it's in a different class of medications. So that's the first major thing. So I like to tell patients not to use Advil, aspirin, Aleve, ibuprofen for about 2 weeks before surgery and about a week to 10 days after surgery. Okay, next thing, vitamins and supplements. So a lot of patients today take a lot of different vitamins and supplements. So vitamins such as vitamin E, omega-3, fish oil, green tea, St. John's wort, all of these medications have a very similar effect such as the NSAIDs. So they also stop the coagulation cascade. Again, leading to increased bleeding in the operating room. Follow that down the line, increased bruising and swelling. Follow that down the line, increased recovery time. So I like to tell patients to go ahead and stop all general vitamins and supplements. Now, there are certain vitamins and supplements that don't have this problem. So we do go through patients' medications at the time of the preoperative assessment and go, hey, which ones can you take and which ones should you stop? Again, this is very important to discuss with your surgeon. The next major thing is alcohol. So alcohol in that same time period can also thin the blood, and it does it the same way by inhibiting the coagulation cascade. So for that couple of weeks before surgery and about a week to 10 days after surgery, I don't like patients having any type of alcohol. This includes beer, wine, as well as hard liquor. All of them kind of have the same overall side effects, so therefore it's just a lot easier to just stop all of that. So this is a good thing that starts right at about that 2-week point before surgery. Okay. Now the next thing, as we kind of progress down the road, I like to do when I do my preoperative assessment is I'll go ahead and send the patient's prescriptions to the pharmacy. And the reason for this is that patients then have more than enough time to go to the pharmacy, pick up the necessary medications for after surgery, and keep them at home. So after surgery, there's no rush to go run down to the neighborhood pharmacy, wait in line when you're not feeling so hot after surgery. So that's the next major thing. So we talked about things that you're supposed to stop. Then I go ahead and send the prescription. So your doctor's probably going to do something very similar. Go ahead, make sure what medications you need. And this would be a good time to go ahead and create some sort of a schedule if there are certain medications that need to be taken on a schedule. Okay, moving along. So the next major thing is medicines that you're supposed to take and not supposed to take. Some patients are taking regular medicines on a daily basis. Some of these are blood pressure medicines, some of them are diabetes medicines, sometimes they're taking anticoagulants. So all of these medications need to be discussed with your surgeon. Okay, there are some medicines that you're probably going to continue, and there may be others that you may need to stop temporarily. Please do not just go ahead and willy-nilly stop them. Okay, there are certain medications that need to be tapered off, so there's a lot of things going on. So go ahead and make sure you're very honest with your surgeon about the medicines you're taking so that they can counsel you with respect to what you're supposed to do and what you're supposed to stop. For example, currently a lot of people are on the class of medications as Ozempic. Those medications need to be stopped in the perioperative period, and there's very specific protocols on when they need to be stopped and when they're supposed to be restarted, if they're going to be restarted. So please keep those kinds of things in mind. As that timeline continues closer and closer to surgery, so when the patients are going to the pharmacy to pick up the medications, there's a couple of things that I recommend that patients go ahead and pick up at the pharmacy or the supermarket in order to make their life easier. So category 1, stuff that helps you make your life easier. So I tell patients to go ahead and get some gauze pads. And the reason for that is after rhinoplasty surgery, many times there may be a little bit of bleeding from the nose. Gauze pads are great to just put a little, you can roll it up kind of like a cigarette. Don't like using that word, but rolling it up and taped up to the cheeks. Okay, a little bit of artificial tears and maybe lubricating eye ointment. Anytime you do surgery on the face, or especially the central portion of the face, patients frequently complain of irritated eyes postoperatively. So if that's the case in you, artificial tears are really easy to use during the day to just put a couple of drops in your eyes, just gives a little bit of lubrication and helps with the irritation. Now at night, if you're having a problem with this, you can use the lubricating eye ointment at night so that you don't have to wake up in the middle of the night to keep adding drops to your eyes. The only issue I see with the lubricating eye ointment is that if you use it during the day, the whole world becomes blurry and it's kind of hard to concentrate and focus, and it really keeps you from doing your daily life activities. Also, I recommend patients pick up Afrin after surgery. So what is Afrin? Afrin is a medication. Normally it's available in the cold and flu aisle. It's a medication that you spray into your nose. Discuss this with your surgeon. Afrin works by basically making the blood vessels inside the nose shrink up. The downstream effects of this is that there's less bleeding immediately postoperatively and also decreases the bruising and swelling that patients experience. For the first 3 to 4 days after rhinoplasty surgery, I pretty much tell patients that they can use Afrin 3, 4, or 5 times a day without too much problem. I give them instructions on how to taper off after that time period. Talk to your surgeon about this and see if he also agrees with this game plan. Another thing that you may want to pick up is nasal saline. Nasal saline comes in 2 categories. One, which is a nasal saline spray. That nasal saline spray is just a small bottle, creates a fine mist that can be sprayed in both the nares, okay? Now what that does is basically spray a little mist of salt water up inside the nostrils to increase the humidity inside the nostrils. Tissues inside the nose like to heal with humidity. So if it gets too dry, you're gonna get more mucus formation, dried blood, so on and so forth. The other side of the nasal saline is nasal saline irrigation, okay? I prefer using nasal saline irrigation made by a company called Neil, N-E-I-L. The product is called Neil's Sinus Rinse. I have no skin in that game. It's just what I like to use. It works very well and it's readily available. What it consists of is a little plastic bottle and there's some salt packets, and you rip open a salt packet, fill the bottle up with water, and you can push it and it basically shoots up salt water one side, comes out the other side. The advantage of this is it really acts like a pressure washer and allows cleaning of the inside of the nose. So there's going to be some dried blood, some dried mucus, so on and so forth. So after about 48 to 72 hours after surgery, I tell patients to go ahead and start that, which helps get all that stuff out of their nose and starts making them feel a lot better. Okay, those are some of the medical supplies that I tell patients that to pick up from the pharmacy. Similarly, from the grocery store, I recommend patients pick up a little bit of Gatorade or Sprite, maybe a little bit of applesauce. Now, why? The reason for this is that rhinoplasty patients frequently may have some nausea and vomiting after surgery. So therefore, before they just start a full normal meal, I like them to start with a little bit of Gatorade or Sprite first. If that goes down okay, they don't seem to have any problems, they can try a little bit of pudding or soup. If that goes down okay, they can eat whatever they feel like. This is to minimize nausea and vomiting in the postoperative period. I like to tell patients to have all these things ready so that they're not having to feel like they have to jump to the grocery store while they're not feeling that great after surgery. So thus far we've talked about medications, what to stop, supplements, going to the grocery store, picking stuff up. There's a very key important point I want to drop in here. Smoking. Smoking in the perioperative period is an absolute no-no. Okay, I don't care what type of surgery you're going to do, but definitely for aesthetic and cosmetic surgery, smoking is a no-no. Every surgeon has a different protocol with respect to smoking and surgery. If you are a smoker or you're recently just quit and you have cravings, please talk to your surgeon about it. Just have an honest conversation so everybody has a game plan. One of the things I think you see as a common theme through this entire discussion is I really like to prepare. So I don't like Chinese fire drills. So it's a lot easier when people give me information. I can schedule stuff, I can prepare for it, I can make game plans rather than waiting till the last moment and then having to rush. That's not my mojo. As we're getting closer and closer to the surgery date, so we've kind of gone through 3 weeks, 2 weeks, now let's talk about the week before surgery. In that week before surgery, this is kind of a few things that I think really makes people's lives easier. Go ahead and have your post-operative instructions ready. Discuss with your partner or someone who's going to be taking care of you the post-operative instructions. Allow them to read it so that everybody is aware of what's going on and what's going to happen. It makes it a lot easier than you've had surgery, you're not feeling very well, they discharge you from the hospital, and you end up home, and this person who's brought you home goes, okay, now what? So preparation is the key to success. So therefore, this is a good time that week before surgery to discuss, hey, I'm coming home from surgery on this day. This is kind of what the doctor told me. I'm going to feel like these are all my medications. So everybody knows where everything is. Now, as you are getting closer and closer to the day of surgery, probably 2 to 3 days before surgery, my expectations of patients are as follows. Get your nightstand or end table ready with all the medications and stuff that you might need. Have a copy of post-operative instructions there. That just makes your life easier, so when you come home, you're not searching for anything. Reconfirm that your fridge is stocked up. You've gotten your post-operative medications. Night before surgery, okay? Night before surgery is very important because as we started off this talk, we said, you know, we're really talking about how to prepare for a rhinoplasty. Most of my rhinoplasty surgeries are done under general anesthesia, which means nothing to eat or drink after midnight the night before surgery. Why is this? So when you eat, stuff goes into your belly and your belly tends to distend, or your stomach distends. Things are held in place by muscle contraction. When you go to the operating room and they give you medications for general anesthesia, a lot of these muscles relax. That's what they do. When they relax, the stomach contents can go retrograde or go up rather than down, and you can aspirate or get some of those stomach contents into your lungs, which can be actually pretty bad. Therefore, keep it simple. Let's not have any issues at all. Just make sure to be NPO or nothing by mouth after midnight the night prior to surgery. Now, if you do take normal medications on a daily basis, whether they be high blood pressure medications or any of those medications, and your doctor has okayed for you to take those medications immediately before surgery, you may take them the morning of surgery, except with a very tiny sip of water. Do not take a whole bunch of ice chips, don't chew gum. All those things are not beneficial for you. When you're getting your nightstand ready the night before surgery to get ready to go the next morning for surgery, please make sure you've got your ID ready, a credit card if it's necessary to pay any additional anesthesia or facility fees. That's pretty much all you need. With respect to clothing, I prefer my patients come to the operating room with very simple clothing, because when they get to the operating room, many times they're going to have to change into a gown. So my recommendations are a blouse or an old work shirt that has buttons in the front, like a tracksuit that has a jacket with a zip also works really well. Pajama pants at the bottom. This is kind of the outfit I recommend. And the reason for that, it's very easy to take on and take off, because after surgery, you might still be under the influence of anesthesia a little bit. You might be a little goofy, and getting dressed might be difficult. So if you've got a whole bunch of straps that need to be laced or things like that, makes life difficult. You're not going to be able to wear a bra or any other thing that has metal touching your body in the operating room. So those kinds of things are unnecessary. So please don't bring them, because it just makes life a little bit more difficult. Leave your jewelry, watches, earrings, all that kind of stuff at home, because you're going to have to take them off. The morning of surgery, take a full shower, scrub down your face, wash your hair. Makeup is unnecessary to come to the operating room. So this is kind of my prep plan for patients as they're preparing for rhinoplasty surgery. Now, there is one big caveat that I would like to include, and this is really, really super important, which is the mental state of the patient. All of our patients, when we do a pre-op, they get a little chart, and that chart tells them what they will feel as they're coming towards surgery, okay? So for example, when you do a consultation for a rhinoplasty, there's a lot of excitement in the air. You get to see maybe a 3D model of your face or an image of what your nose might look like, and you're over the moon. Now, as that, from the point of consultation to the point of surgery, as you are kind of going through that process, the anxiety level will go up. That anxiety is very important. I don't like to prescribe medications to just artificially or pharmacologically shut that down. Being someone who is a surgeon, I go into the operating room. When I have surgery, I get a bit anxious. I think it's a normal human emotion. So just be aware of the fact that your psychological status is like a roller coaster. It's going to go up and down in that preoperative period. We'll create another video about what to expect post-operatively, but I think one of the most important things that I can stress to people as they're getting ready for surgery is your heart and your stomach are going to be in knots, and they're going to go up and down. There are going to be people that are like, I'm so ready, I'm so ready. Then there's going to be times where I'm scared. And the only thing that I think is very important is I'm going to tell them so that this thing up here is really controlling this and says, listen, I know how to keep all these emotions, within their parameters, so that I think knowledge is the key to be able to kind of maintain as much of an equilibrium as possible. So this is kind of a brief rundown of getting ready for rhinoplasty surgery. I hope this really helps people. I hope it kind of gives you an insight of how to prep for this process. And I'm sure your rhinoplasty surgery is going to go fine. Again, I'm going to come back to the disclaimer. Please talk to your surgeon. If there's anything that I'm saying that is in contrast or seems very different to what your surgeon is telling you, follow what your surgeon is telling you. They probably have very specific reasons to why they're telling you that. So go ahead and follow what they're telling you. I think that's very important. If you like this video, please click on the subscribe button. It tells us that people are watching, people like it, and put more content out there just like this. If you have comments, more things you'd like to know about, other questions, please leave them in the DMs or in the comment section down below. We will go through them. We look at them all the time, and it gives us idea for more content that we're going to put out there. So thank you so much for listening today. Look forward to meeting you.